The air in the exam room is thick, with the smell of antiseptic and anxiety. You've got the vitals machine beeping steadily, a chart full of notes, and a patient sitting on the edge of the exam table, staring at a spot on the floor. He's a man in his late 40s, construction worker. He's here for the third time in 2 months, for the same complaint. A dull, radiating back pain that no one can find a source for. You've done this intake twice before. You ask the routine questions, your fingers flying across the keyboard. On a scale of 1 to 10, how's the pain today? He grunts. An 8. But you look up from your screen, and you really look at him. His shoulders are slumped. His eyes are hollow. He looks heavy. Heavier than any back pain could explain. And in that moment, a question flashes in your mind. A question that isn't on your intake form. What's really going on here? But the clock is ticking. You have 3 other patients waiting. So you push that thought down, finish your notes, and you say, the doctor will be in shortly. You close the door behind you, leaving him alone with that spot on the floor. Welcome back to MAP, Medical Pathways for Success. I'm your host, Fred Nazario Alvarado. That moment in the exam room. That's a crossroad we face every single day in the field, isn't it? The choice between efficiency and empathy. The pressure is real. The patient load is heavy. The clock is our enemy. And we tell ourselves, we just don't have time to dig deeper. But if we were brutally honest with ourselves, time isn't the reason we walk away. The real reason is fear. It's the fear of opening a door we don't know how to close. The fear of asking a question and getting an answer that we aren't equipped to handle. The fear of making things worse. I know that feeling intimately. I've been that person. Closing the exam room door. Telling myself it wasn't my place to ask. I remember pushing for a mental health first aid class at one of my old jobs. Knowing my team needed it. Knowing I needed it. But the answer was always the same. We're too busy. The urgent physical work always took priority over the quiet, invisible wounds. That excuse ends today. This episode is the class I never got to take. It's the conversation we all need to have. Over the next however many minutes it takes, we're going to dismantle that fear. We're going to turn that uncertainty into a plan. We're going to give you the words, the confidence, and the armor to be the person who doesn't walk away. So today, we're not just talking about mental health. We're talking about courage. The courage to see the invisible patient. Here's the first thing you have to understand about mental health in a primary care or urgent care setting. The physical complaint is often just a ticket to get into the door. Think about it. Our society has, for the most part, accepted that physical pain is real. If you have a broken arm, no one tells you to just get over it. But if you have a broken spirit, the stigma is still so powerful that people will do anything to avoid admitting it, even to themselves. So they come to us. They come to a place where it's safe to be in pain. They use a headache or back pain or crippling fatigue as a costume. It's their socially acceptable reason to finally ask for help, even if they don't know how to ask for the help they really need. As a medical assistant, a phlebotomist, a tech, a nurse, you're a gatekeeper. You're the first human connection they make in that vulnerable space. You spend more time with that patient during intake than the provider often does. And that is a sacred responsibility. If you have tunnel vision, if you just focus on checking the boxes on that screen, you're missing the entire patient. Your job is to become a detective of the human condition. You need to look for the mismatch. I'm talking about the patient that tells you their pain is 9 out of 10, but they're sitting there calmly scrolling through their phone. Or how about that teenager who's in for a simple sports physical, but they're sweating. Their leg is bouncing and they can't look you in the eye. Or about that new mother who should be glowing, but she looks disheveled, exhausted, and when you ask about how the baby is, her answer is completely flat, without a drop of emotion. These are what I call the soft vitals. You can't measure them with a cuff or a thermometer, but they are telling you a story. They're screaming that the patient is crashing on the inside. And your job, your purpose, is to be the one who is willing to listen to that story. In school, they drill the numbers into us, right? Temperature, pulse, respirations, blood pressure, TPR and BP. We can recite the normal ranges in our sleep. They are the foundation of our physical assessment. I want you to treat soft vitals with that same level of importance. I want you to create a new checklist in your mind, one you run through with every single patient, just as automatically as you reach for the blood pressure cuff. Let's build the checklist together. I call it the 4 pillars of observation. Pillar 1, appearance. This is the first thing you notice. Before you even say a word, is there a significant change from their baseline? We're looking for signs that basic self-care has become too difficult. Look at hygiene. Is their hair unwashed? Do they have body odor? Are their clothes dry? When the energy it takes to simply shower feels like climbing a mountain, that's a major sign of depression. Grooming and dress. Is the patient who always came in dressed for work now in stained sweatpants? Does their clothing look like they just rolled out of bed? And how about weight? Have you noticed a significant, unintentional weight change? Both major weight loss and gain can be physical manifestations of deep emotional distress. Pillar number 2, affect and speech. This is all about their emotional weather. Affect is the emotional expression on their face and in their voice. You have flat affect, This is the mismatch we talked about. A patient describing a devastating event with a monotone voice and a blank face. It's one of the most jarring soft vitals you can witness. You have pressured speech. Are they talking a mile a minute, jumping from one topic to the next, so fast you can barely keep up? This can be a sign of severe anxiety, mania, or even psychosis. Slowed speech. On the flip side, are they struggling to get the words out? Long pauses between words, as if speaking is physically exhausting. This is a classic sign of deep depression. Pillar 3. Behavior and body language. The body tells a story, the mouth won't. You need to learn how to read it. Psychomotor agitation. This is the restless energy, the bouncing leg, the constant fidgeting with their hands, tapping their fingers, pacing if they're able. Their body is literally buzzing with anxiety it cannot contain. Psychomotor retardation. This is the opposite. A visible slowing of all physical movements. They look like they're moving through molasses. Their posture is slumped. Shoulders are caved in. They look physically weighed down by their sadness. And then you have eye contact. Are they avoiding your gaze completely, staring at the floor? Or is their stare uncomfortably intense and fixed? Both are signs that something is off. Pillar number 4. Rapport and engagement. This is the last pillar, and it's all about how they interact with you. Irritability. Is the normally pleasant patient now snappy, short-tempered, and defensive? For many people, especially men, yes, I include myself, irritability is the primary mask that depression wears. Withdrawal. Are they giving you one-word answers? Do they seem disconnected, like they're a million miles away? Are you feeling like you have to drag information out of them? And then there's tearfulness. Do their eyes well up when you ask a simple, non-threatening question like, "How have you been?" That emotional fragility is a sign that they are right on the edge. So remember, appearance, affect, behavior, rapport. These are your new vitals. I want you to start consciously looking for them. You are not diagnosing. And let me repeat that. You are not diagnosing. You're a detective, gathering clues, and you're noticing a pattern. When you see these signs, when you spot these mismatches, you can no longer tell yourself, it's probably nothing, or it's none of my business. It is your business, because it's your job. But I know what stops you. It's that fear we talked about. The fear of what to do next. So let's tackle this head on. Now, before we go any further, we have to stop and dismantle a dangerous myth. It's a piece of misinformation that has cost lives. And it prevents good, caring healthcare professionals from doing their job. The myth is, if I ask a patient if they are thinking about suicide, I will put that idea in their head. Let me be as clear as I possibly can be about this. This is absolutely, unequivocally false. Study after study, expert after expert, has proven this to be untrue. I want you to picture a pressure cooker. If a person is suicidal, that thought isn't a tiny seed you might plant. It's a pressure cooker that has been building inside their head for weeks, or months, or even years. The thought is already there. It's loud, it's relentless, and it's isolating. When you ask the question, you are not putting anything in. You are giving them a chance to let something out. You are gently turning the release valve on that pressure cooker. You're signaling to them, I see your pain. And you don't have to hold that pressure all by yourself. Asking brings relief, not risk. It brings connection, not contagion. So I need you to make a decision right now to throw that fear in the trash. Because in this field, your silence is infinitely more dangerous than your question. In the official mental health first aid course, they teach a 5-step action plan using the acronym ALGE. It stands for Assess for Risk, Listen Non-Judgmentally, Give Reassurance, Encourage Professional Help, and Encourage Self-Help. It's a fantastic framework. But let's be real. You have, let's say, 10 minutes, give or take, to room a patient while updating their chart and getting their vitals. You don't have time for a 5-step intervention. So, I've adapted it for our world. We're going to focus on the 2 most crucial steps for the front lines: the approach and the listen. First, the approach. This is all about noticing the change and reflecting it back to them. You don't need to be the therapist for this. You just need to be a human mirror. The key is to use I noticed statements. They are observations, not judgments. For an older patient, for example, it might sound like, Hey, Mr. Smith, I noticed you seem a little quieter than usual today. I just wanted to check in and see how you're doing. For a younger person, it could be, I notice you seem really tired. Is everything okay? The words are less important than the intention. You're simply opening a door and letting them know that they can walk through it if they need to. Second, the listen. Now, this is where the magic happens. When you ask that question, 9 times out of 10, their first response will be a deflection. I'm fine. Just tired. It's nothing. Your instinct will be to accept that and move on. I want you to fight that instinct. I want you to employ what I call the 5-second pause. After they say, I'm fine, or whatever it is, I want you to hold eye contact, offer a gentle, empathetic expression, and just be silent for 5 full seconds. It will feel awkward. It will feel like an eternity. But in that silence, you're communicating something profound. You're saying, I'm not just checking a box. I see you. And I have a moment if you want to tell me the truth. That pause gives them permission. It gives them a moment to decide if they want to take the risk of being vulnerable. Okay, now, so you did it. You held the pause and it worked. The patient's composure cracks. Their eyes well up. They take a shaky breath and the story starts to come out. Your heart is probably pounding. Your first thought is, oh shit, now what? This is the moment that separates a technician from a healer. Let's prepare you for it. The stories you hear will generally fall into a few categories. You might hear the story of overwhelm. It sounds like, I'm just so tired, friend. I'm working 2 jobs. My kids are sick. The car broke down. I just can't catch a break. I feel like I'm drowning. You might hear the story of grief. My husband just passed away 6 months ago. And everyone keeps saying, it should be getting easier. But it's not. I feel so lost without him. You might hear the story of anxiety. I have this constant feeling of dread. I'm so worried about losing my job that I can't sleep. My heart is always racing. Or you might hear the story of hopelessness. Honestly, I just don't see the point anymore. Nothing I do makes a difference. I feel like a burden to my family. When you hear these stories, your brain will scream at you to fix it, to offer a solution, to say something wise. But you need to ignore that impulse. Your job right now is not to fix. It's to validate. Here's your first response toolkit. I want you to burn these phrases into your memory. The single most powerful thing you can say is this: thank you for telling me. This simple sentence honors their courage. It tells them their vulnerability was received safely. Then follow it up with pure validation. Pick one of these. That sounds incredibly difficult. I'm so sorry you're carrying all that. That's a heavy weight to bear. Your goal is to be a mirror, reflecting back the emotion they are showing. You are telling them, what you're feeling is real. And I see it. Now, just as important, here is the do not say list. These are the conversational landmines that will shut a patient down instantly. Do not say, I know exactly how you feel. You don't. Even if you've been through something similar, their experience is their own. It turns the conversation and makes it about you. Do not offer platitudes. Avoid things like, everything happens for a reason, or look on the bright side, or this too shall pass. These phrases are dismissive and invalidate their pain. Don't jump to solutions. You should try yoga, or have you tried getting more sleep? This isn't helpful. It's a subtle way of saying their problem is simple and they just aren't trying hard enough. Do not express shock or pity. A wide-eyed, oh my God, that's awful, can make them feel like a spectacle. Keep your tone calm, steady, and compassionate. Your only job in this moment is to be a safe harbor, to listen, to validate. And then, once they have been heard, your job is to build the bridge to the next level of care. This next part is the most important piece of armor I can give you. You need to understand your role. And more importantly, you need to understand what is not your role. Your job here is to be the scout, not the sniper. You're not a therapist. You're not a social worker or a psychiatrist. It's not your job to diagnose, treat, or fix their depression, their anxiety, or whatever it is. Do not give them life advice. Do not tell them to just think positive. And be incredibly careful about sharing your own struggles, because you can inadvertently make it about you instead of them. Your one and only job is to be the scout. To go out ahead, spot the signs of a crisis, and radio it in to the provider. When a patient finally opens up to you, your goal is not to solve their problem. Your goal is to bridge them to the next level of care. And your script is simple and powerful. Thank you so much for trusting me with that. That sounds incredibly heavy, and I'm so glad you just told me. It takes a lot of courage to say that out loud. My next step is to make sure Dr. Jones understands what's going on so we can get you the right support. Is it okay if I share this with her? You are the bridge. If you try to carry them across the river yourself, you're both going to drown. And let's be brutally honest for a second. Sometimes, the system you're radioing into is broken. As one report from the Manhattan Institute points out, a major barrier to care isn't a lack of recognition, but a scarcity of providers and services. You might connect a patient to a therapist, only for them to find out there's a 6-month waiting list. That's a frustrating, heartbreaking reality of our healthcare system. And that failure is not on you. This is where so many of us burn out. We take on the weight of the entire system. A qualitative study of mental health first aiders found that the role comes with a big weight on your shoulders. A feeling of anxiety and an immense pressure to do more. This is where self-compassion becomes non-negotiable. So how do you do that? How do you actually separate your responsibility from the system's responsibility when you're the one looking into the patient's disappointed eyes? How do you just let it go when every part of you wants to hold on and fix it? I'm going to give you a 3-step mental exercise. I call it filing the Scouts report. I want you to practice this every time you feel the weight of the system settling on your shoulders. Step 1, define your mission. After the encounter, I want you to ask yourself one question. What was my specific mission in that room? Your mission was not to get the patient into therapy. It was not to solve their financial problems. It was not to cure their depression. Your mission was to notice, to ask, to listen, and to report. That's it. Did you do those 4 things? Did you see their pain? Did you create a safe space for them to talk? Did you validate what you heard? And did you successfully bridge them to the provider? If the answer is yes, then you must acknowledge to yourself, mission accomplished. You did your job perfectly. Step 2, file the report. This is a mental ritual. I want you to physically visualize it. After you've documented everything in the chart and passed the information on, I want you to take a deep breath. Picture a manila folder in your mind with the patient's name on it. See yourself placing your notes, the scout's report, inside of it. Then, visualize yourself closing the folder, turning, and placing it into a filing cabinet. As you slide the drawer shut, I want you to say the phrase to yourself, either out loud or in your head. My part is done. This isn't about forgetting the patient. It's about creating a clear, psychological boundary. It's the mental equivalent of a handoff. You have successfully passed the baton. The next leg of the race belongs to somebody else. Step 3, place the frustration where it belongs. Now, you might still feel angry. You might still feel frustrated that the system is failing that patient. That's okay. In fact, that's a sign of your compassion. But you have to place that anger correctly. It's okay to be angry at the system. It's okay to be frustrated with insurance companies, with wait times, and with lack of resources. But that anger, that frustration, it belongs to the system, not to you. Don't internalize it as your own personal failure. You can say to yourself, it's infuriating that this patient has to wait 6 months for care. That's a systemic failure. By naming it, you are externalizing it. You are refusing to carry a burden that isn't yours to carry. This process, define the mission, file the report, and place the frustration, is not about becoming cold or detached. It's the exact opposite. It's the only way to sustain your compassion. If you carry the full weight of every patient and every systemic failure, you will burn out. You will become cynical. You will lose the very empathy that makes you so good at what you do. Your compassion is a finite, precious resource. Protect it like one. And this is how. But what happens when the situation is not just a struggle, but an emergency? What if the patient says something that makes the hair on your arm stand up? I just don't want to wake up anymore. My family would be so much better without me. I have a plan to end it. This is a code blue for the soul. You cannot ignore it. You cannot pass it off. You cannot just put it in the notes. This is the moment where you have to step up. You have to ask the hard question. And you have to ask it directly. So don't dance around it. Do not say, "You aren't thinking of doing something silly, are you?" That minimizes their pain and it shames them. Don't say, "You don't want to hurt yourself, right?" That's a leading question. That pressures them to give you the correct answer. You look them in the eye. You take a calm breath. And with all the compassion you can muster, you ask, "Are you having thoughts about suicide? Or are you thinking about killing yourself?" It has to be that clear. No euphemisms. If they say yes, your mission becomes crystal clear. You do not leave them alone. You page the provider immediately. You call for a nurse. You activate whatever your facility protocol is. But you stay with the patient. You become their anchor in the storm. You don't need to have the answers. You just need to be the human presence. You can say, "Thank you for telling me. I'm right here with you. We're going to figure this out together." Your presence is the intervention. Now, let me tell you what will happen inside of you in that moment. Your heart will be hammering against your ribs. Your training might feel like a million miles away, and your mind will be screaming, "Am I doing this right? What do I say? What if I say the wrong thing?" In that moment of chaos, I need you to hold onto a single powerful thought. You are not there to calm the storm. You are there to be the lighthouse in it. The patient is lost in a hurricane of pain. They are being tossed around by waves of hopelessness and despair. You can't stop the wind or the rain, but you can be the one solid, unmovable point of light in their world. Your job is to be steady when everything for them is spinning. Your calm becomes their lifeline. Your quiet presence is the anchor that keeps them from being swept out to sea. This is the moment where you do more than just your job. This is the moment you hold a human life in your hands simply by refusing to let go. I know that's a heavy scenario to think about. It's one thing to talk about it here in the safety of this podcast, but it's another thing entirely to be in that room with the words caught in your throat. So, let's not leave it up to chance. Let's prepare for it. Let's build that muscle memory right now so that when that moment comes, you don't have to search for the words. You can just be the lighthouse. That's what this week's Map Moment is all about.
It's time for your map moment. A quick little push to keep you going. Stay focused, keep strong. Your pathway to success is on.
Becoming the lighthouse in the storm doesn't happen by accident. It happens through preparation. It's about having the right words ready so you can focus all your energy on being that steady, compassionate presence. That's what this week's map moment is all about. It's your training ground. Your challenge is to learn and practice the bridge statement. This is how you ask, "Are you safe?" without it feeling like an interrogation. Here's the script. Write it down. Put it in the Notes app on your phone. I'll even put in a chapter marker so you can come back to the spot to get this information again. But make sure you practice it. And here it is. I hear how much pain you're in right now. It sounds completely overwhelming. Sometimes, when people are in that much pain, they often have thoughts about ending their life. So I need to ask, are you having any thoughts like that? Let's break down why this is so effective. Number one, I hear your pain. You start off with validation. You prove you're listening. Number two, sometimes people. You're normalizing their experience. You're telling them they aren't alone in this feeling. So it removes the shame. And number three, I need to ask. You ask directly, but you frame it as your responsibility, which it is. So your challenge is not just to memorize this phrase. It's to embody the feeling behind it. Say it out loud until it doesn't feel awkward. Say it to your reflection in the mirror and watch your own face as you do. See the compassion in your eyes. Say it in your car on the way to work until the words feel like your own. The goal is to make this approach so second-natured that when the moment comes, you're not thinking about the words. You're thinking about the human being in front of you. The statement becomes the track, allowing your train of compassion to run smoothly and safely. Now let's talk about the win, because this is where the real empowerment lies. The heaviest thing you will ever carry in this career is not the grief for a patient you lost. It's the regret for a patient you never tried to save. It's the weight of the words you were too afraid to say. It's the what if that will haunt you at 3 a.m. for years to come. But when you practice this, when you arm yourself with this tool, you give yourself a different future. You give yourself the gift of knowing you were ready. This win isn't just about the patient. It's about you. It's about the person you get to be at the end of that shift. The person who drives home not haunted by what ifs, but grounded in the quiet confidence of, I did my part. I was a scout. I was the lighthouse. That is the ultimate act of self-compassion. Freeing your future self from the burden of regret. You're not just learning a phrase. You are forging a new piece of your armor. You are making a decision about the kind of healthcare professional you are going to be when it matters most. That is a victory that will stay with you for the rest of your career. In healthcare, we are taught to be healers. We are taught to fix things, to set the bone, to stitch the wound. But some wounds are not ours to fix. They are ours to see. The work we've talked about today, the work of seeing the invisible patient, is not about having all the answers. It's about being the lighthouse. You are not the rescue boat, responsible for pulling every single person out of the raging sea. That's an impossible task that will only lead you to drown alongside them. You are the lighthouse. Steady, strong, grounded. Your job is to shine a light in the darkness, to be a beacon of safety and non-judgment, to guide the ships that are lost in the storm toward the safety of the harbor. Some ships will turn toward your light. Some may not. You cannot force them. But your job is to keep shining regardless. Every time you make eye contact, every time you hold the 5-second pause, every time you ask the hard question, you are turning on that light. You are fulfilling your highest purpose as a healthcare professional. The question isn't if you will face this moment. The question is, who will you choose to be when you do? So watch your patience, maintain your light, and keep following your map, your medical pathway for success.